Hello, how are you? Are you also one of those people who suffers when you lie down and your nose immediately gets stuffy? Many people say that they get ready for bed, put their head on the pillow, and within a few minutes, it feels like their nose has simply closed up. First, it gets stuffy on the left side, then you turn to the side and it gets stuffy on the right side. Then you find yourself forced to breathe through your mouth, you can't sleep well, your sleep becomes fragmented, you snore, it bothers the person next to you, you wake up with that scratchy throat feeling like you haven't rested at all. So, in this video, I'm going to tell you why this happens. Why when you're standing up working or sitting down, you breathe well, but when you lie down, you don't. I'm going to explain to you what happens and how your diet, even your dinner, can make this situation worse. Stay until the end because you won't want to miss it. Before we start, I want to ask, do you suffer from this or not? What do you do to improve your stuffy nose at night? Write it for me down here in the comments. So why does my nose get stuffy right at that time? The time we go to sleep, when we want to relax, want to be comfortable, is the time when the nose gets the most stuffy. Why does this happen? We have to understand the issue of gravity, right? And how it acts on our body. When we are standing or sitting during the day, obviously, gravity helps pull blood downwards, distributing blood flow evenly through the legs, the abdomen, and everything else. When we lie down, this gravitational effect ceases immediately, the blood that was in the extremities redistributes, and there is a natural increase in blood pressure in the thoracic region of the head. So that right there is already a big issue. So it also happens that inside the nasal cavity, we have a structure called the nasal turbinate or nasal conchae, which are responsible for warming and filtering the air that is entering through there. But the big secret is that these turbinates are lined with a highly vascularized tissue. And so when you lie down and blood migrates to your head, these blood vessels inside the turbinates receive an extra supply of blood and inflate just like a balloon. And the physical space for air to pass through decreases, of course, drastically, because a structure inside the nose has inflated, creating a mechanical sensation of a blocked nose. Up to that point, this is a physiological, normal process. The problem happens when this swelling of the turbinates becomes excessive due to an inflammation that we ourselves end up creating in our bodies. Then a cascade effect happens, right? Because the nose closes, the brain gets desperate, and for survival reasons, you activate that plan B, which is breathing through the mouth. The problem is that the mouth was made for eating, for speaking. It wasn't made for breathing. The nose purifies, warms, and humidifies the air. The mouth sends cold, dry, and impurity-filled air into your throat. And that's when it happened. The cascade effect I told you about happens because this dry and cold air dries out the mucous membranes, causing you to wake up with your mouth feeling sticky and with a sore throat. Furthermore, this mouth breathing causes the soft palate tissue to vibrate, which leads to snoring. And this turbulent airflow prevents you from reaching the deep sleep stages. This causes what we call nocturnal micro-awakenings. Sometimes you don't realize you've woken up, but your body wakes up and your brain ends up not being able to get enough oxygen. Your blood pressure rises during the night when it should be dropping, and then you end up waking up more tired than before you went to sleep. Then there are people who wake up with a headache in the morning, chronic bad breath, a bunch of things. Some people have this more than others, right? Some people say, so why does someone I know get stuffed up much more or much less than I do? Sometimes even in the same bed, right? A couple, one gets completely stuffed up and the other doesn't. So some people already have a silent chronic inflammation in this nasal mucosa. People who have allergic rhinitis, chronic sinusitis, a deviated septum, nasal polyps, already have those blood vessels in their nose at the limit of sensitivity. So in these people, right, this mucosa is already called hyperreactive. When blood leaves the horizontal position and reaches a previously inflamed area, the swelling ends up being much greater than in someone who isn't inflamed. So the airway really does close, and that's where the role of diet can help you or worsen this inflammation. Of course, when we talk about sleeping, we have to talk about dinner because dinner is the meal closest to that time. And some things people do at dinner time can make this feeling of a stuffy nose even worse. So the first thing for sure is eating dinner too late. The issue of silent reflux, which I've already explained to you in other videos, is one of the biggest saboteurs that exist. Even if you eat food considered healthy, if that food is consumed immediately before lying down, you have the perfect scenario for laryngopharyngeal reflux. Because this reflux is a hidden reflux, you don't need heartburn or burning sensations to have it. It is called silent reflux because stomach acid and an enzyme called pepsin rise in the form of microvapor through the esophagus during the night and reach the throat, the larynx, the upper airways. So when this acidic vapor hits the mucosa, which is already ultra-sensitive, the body reacts by trying to defend itself, producing excess mucus, throat clearing, and then it dilates the blood vessels in the nose to try to wash that area, and then it becomes a mess. and there's really no clear reference like, but my stomach has terrible heartburn. I'm feeling completely unwell. No, that's exactly it. So the rule is, test this today. 2 hours, 3 hours before you go to sleep is the time for your last meal. Preferably 3 hours before you go to sleep. And of course, a light diet, right? Without fried foods, without fat, without spicy foods, without alcohol will also help with this issue of preventing silent reflux at night. The second thing to pay attention to at night, I'm talking about before sleeping, is dairy products. People whose congestion gets much worse usually consume milk before sleeping. A lot of cheese, cream cheese, yogurt as part of dinner, or a late night snack. A late night snack is a meal that people forget they have because sometimes it's not organized, but before sleeping they have a glass of milk, eat a yogurt. In individuals who already have a predisposition to respiratory allergies, milk proteins, especially casein, are highly immunogenic. So the body views these proteins as a threat and triggers that immunological cascade, which once again increases the production of thick mucus in the airways, which stimulates the release of antibodies and causes local edema. So if you have a habit of drinking milk, warm milk, hot milk, eating a cheese sandwich before bed, and you live with a stuffy nose, try the test. Go a week without it, then come back here and tell me if it improved or not. Another thing that is very harmful to people is sugar and refined carbohydrates in that last meal. So white bread, white pasta, white rice, pizza, sandwiches at night, sweets, obviously dessert in a broader sense, will cause an immediate glycemic spike, which will then lead to an increase in blood insulin. The excess insulin and glucose greatly increase acute vascular inflammation. These blood vessels temporarily lose the ability to maintain the correct tone, tending to dilate and retain fluid in the soft tissues. And then, once again, the mucosa becomes inflamed. Because it is highly vascularized, this inflammation causes it to retain a lot of fluid and swell significantly. So the ideal is for you to avoid consuming sugar and simple carbohydrates before sleeping in that evening meal. Of course, we can't help but talk about alcohol too, right? Many people who, when they consume wine, beer, whiskey, or a cocktail before bed, find that their breathing gets blocked right after and they snore heavily. This is not a coincidence, right? It is actually a pharmacological effect of alcohol because it is a systemic vasodilator. It relaxes the smooth muscle of the blood vessels, causing blood to flow in greater volume and with less resistance. When this vasodilator effect is added to the redistribution caused by the horizontal position, the vessels become engorged, meaning much more blood reaches these nasal vessels, and then the turbinates expand to the maximum, blocking the passage of air and drastically worsening the intensity of snoring, apnea, and breathing difficulties. So, if you suffer from a stuffy nose, also avoid consuming alcohol at night because it will certainly make the situation worse. There's also the issue of excess salt and histamine, right? Consuming a very salty dinner, dried meat, cold cuts, processed products, instant soup packets, noodles like instant ramen promotes severe water retention in the body during the night. The sodium pulls water out of the cells, creates microedemas, and the nose really feels that. Furthermore, many of these foods I mentioned to you, like cheese, which has a lot of salt, ham, salami, are foods very rich in histamine or are biological histamine liberators. And histamine is the molecule responsible for triggering the symptoms of a rhinitis crisis. So itching, sneezing, runny nose production, and especially nasal swelling. So eating a dinner that is rich in histamine or foods that cause an increase in histamine in the body will certainly make this condition even worse. Another important tip is, if you suffer a lot from a stuffy nose, do a nasal rinse a little bit before going to sleep. You can use saline solution. Nowadays, there are even squeeze bottles that you fill with saline, put in your nose, and tilt your head to the side. You can also do this with a syringe without too much pressure to help wash your nose, to help remove allergens, dust mites, pollution, which will help to reduce this inflammation, right, when we remove these things. Another thing is to improve your sleeping position by elevating the head of the bed. Raising the head of the bed by about 4 to 6 inches. This can help prevent acid reflux and may also help reduce pressure in the head, which can make a big difference. And be careful with the environment. Air conditioning, a fan blowing directly on you at night, old rugs, dirty curtains, everything that can accumulate dust, mites, and dirt can worsen this condition. It might be what's harming you at night as well. If you have a stuffy nose every day, regardless of what you eat, if you snore very loudly to the point of waking someone else up, if you feel very tired in the morning, feel like your night's sleep didn't seem to do any good, have strong pain in your face, forehead, around your eyes, it's important that you go to the doctor. There are things we've been feeling for so long that we say, there's no point in doing anything about this anymore. There is a point, and it could be a sign of something more serious for you. So when in doubt, look for a professional in your city to help you. Remember that the idea of the video is to help you, but the video is merely informative. So, a person who knows you personally, a personal doctor, will give you even more interesting tips for your specific condition. If you like this type of content, leave a like on the video, it helps me too, and share it with someone you know will like it. Let's expand this chain of kindness. That's what I want with the channel. See you next time. Bye.